infection is reduced. They gain control of their sexual and reproductive life and are more likely to access vital health services. They also acquire essential knowledge and skills to boost their autonomy and economic potential. From homes to schools and communities, Education Plus is driving action and steering Africa towards a gender-equitable future. A future they get to decide on. Let's stand with them by putting gender justice at the heart of education. Together, we can end AIDS by 2030 with safe, strong, skilled and empowered girls and young women in the lead. Safe, strong, and empowered. That's how all adolescent girls should be. But how can they be if they're still denied a place in the classroom? 2 decades after the Maputo Protocol, many girls in Africa still have no access to secondary school. Their sexual and reproductive health and rights hang in the balance. Comprehensive sexuality education, which teaches girls how to protect themselves against HIV and other sexually transmitted infections, remains inadequate, both in and outside of school, and the consequences are alarming. Today, adolescent girls and young women in sub-Saharan Africa are 3 times more likely to acquire HIV than their male peers. Gender-based violence, teenage pregnancy, and forced marriage are a reality for millions. Without a proper education or vocational skills, many girls and young women are trapped in poverty and excluded from pivotal decision-making roles in private and public spheres. The evidence is crystal clear. We need a reset, and the classroom is where real change must begin. That's why 5 United Nations agencies and diverse stakeholders have come together under the Education Plus initiative to establish secondary education as a fundamental right for all young people. When girls stay longer in school, their risk of HIV infection is reduced. They gain control of their sexual and reproductive life and are more likely to access vital health services. They also acquire essential knowledge and skills to boost their autonomy and economic potential. From homes to schools and communities, Education Plus is driving action and steering Africa towards a gender-equitable future. A future they get to decide on. Let's stand with them by putting gender justice at the heart of education. Together, we can end AIDS by 2030 with safe, strong, skilled and empowered girls and young women in the lead.
Okay. Good afternoon, good morning, good evening from wherever we have joined the webinar. Welcome to this webinar. My name is Diana Tivesikwa. I am one of the moderators of the 2-hour webinar, and I will be doing this with a second moderator who is also online and will later introduce herself. She is called Rahma Saleman. Today's webinar has been organized under a theme, creating an enabling environment for comprehensive sexuality education as a preventative tool for new HIV infections and teenage pregnancies. The objectives of the webinar
lost your sound, Diana.
For HIV and teenage pregnancies. So, teenage pregnancies. So I want to invite Rahma to introduce herself and also continue with the program. Yes, Rahma.
Good afternoon, everyone. My name is Rahma Suleiman Jumane, and I'm part of Education Plus Initiative platform. Welcome, everyone, and thank you very much, Diana. And before we move forward, I would like to encourage everyone in this platform to make sure that they engage effectively. And please make sure if you have any questions, you can actually interact with us through the chat box. And if you have any feedback or you want to participate in the discussions, feel free to go through that way. In this today's webinar, as we all know that it is very important to understand the effect of HIV and AIDS, especially in sub-Saharan African countries. And it's been one of the key significant issue as public health in sub-Saharan Africa. And today here we are trying to make sure that we are creating a platform as a community to make sure that we promote the comprehensive sexuality education, but also strategies how we can effectively work together to implement that, but also fostering the collaboration between us and making sure that we reach out to the impactful targets that we are all aiming for the young people of sub-Saharan African countries, but also the global at large. On my side, yeah. Do you have anything else, Diana, to add on that before I proceed?
Sure. Thank you so much, Rahma, for giving us a brief and a background to today's webinar. I think it is also important for us to note that adolescent sexual reproductive health is one of the public health related issues globally that is affecting different countries, different regions, and still poses a challenge across the globe. And looking at also the population in Africa between the ages of 15 to 19 are young people, and actually takes the biggest chunk of young people across the globe. This places young people in a very risky position in terms of young people being prone to HIV infections and having unwanted pregnancies. And so the comprehensive sexuality education is one of the tools that have been confirmed to be one of those that would help in addressing such problems, all these two problems. So today's webinar provides us a platform to have a conversation with various experts that we shall be introducing later on as we move forward, to including actually the congregation or anyone, all people who have logged on onto this webinar. We want to have a fruitful and an open conversation on how best we can have comprehensive sexuality education fully implemented across the African countries. Yes, Rahma. Yes, Rahma. Are you with us? Okay. I will go ahead as Rahma fixes some technical issues. This webinar has been organized jointly with three organizations: Education Plus, AHF Africa, and African Reach. A brief background about the three organizations, and I'll start with Africa Reach. Africa Reach began its work in June 2022, following the first Leadership Council meeting. This initiative brings together Africa's political and cultural strength, along with leaders from different generations, to create a new plan to end AIDS among children and young people in Africa. It was created to address the gaps in HIV care and treatment for children and young people living with HIV. Education Plus, another partner that also jointly joined this preparation of this webinar. Education Plus is an initiative that is which is political. Education Plus is an initiative and is bringing together political effort to prevent HIV by empowering adolescent girls and young women in sub-Saharan Africa, focusing on secondary education. It aims to tackle high HIV rates and promote gender equality. So far, 15 African countries have joined the initiative with leadership from 5 UN agencies to include UNAIDS, UNESCO, UNFPA, UNICEF, and UN Women, and involvement of government, civil society, Young Women's Network, and international partners. The AIDS Healthcare Foundation is also a global nonprofit organization that provides healthcare and advocacy to over 2 million people in now 47 countries. Since 1987, HF has supported people living with HIV and AIDS worldwide, becoming the largest provider of HIV care and treatment. It operates in Africa, Asia, Europe, and Latin America and Caribbean, and is known for its innovative approaches to treatment, prevention, and advocacy. So these are the 3 organizations that have been behind the preparation and organizing of this important webinar, and we are looking forward to having a fruitful discussion. At this note, I would like to invite Rahma to introduce or talk about the key main speakers who are going to form part of this conversation, to get to know a little bit about them so that we get comfortable so knowing that we have experts who are going to speak to their subjects. So I would like to invite Rahma to introduce the first set of speakers. Yes, Rahma.
Thank you very much, Diana. On my side, I have three key panelists to our webinar, and the first one is Anne Gituku Shongwe. Apologies for my pronunciation. She is a director for UNAIDS Regional Support Team for Eastern and Southern Africa. She has over 20 years of experience as a senior international development professional. And we are happy today to have her in this potential platform and hear her insights towards the cause. The second panelist, we have Maria Bakarudis. She's a sexologist with over 30 years of experience in sexual reproductive health and rights and sexuality education across 5 continents. And today, she's going to share her experience more in comprehensive sexuality education as a specialist, as well as disability inclusion focal point for UNFPA Eastern and Southern Africa regional office. So we are happy to have her. And the last person from my side, we have Diana Tibesigwa. She's a policy and advocacy specialist with more than 13 years of experience in the youth health education and livelihoods, as well as HIV and AIDS community engagement and other mainstream around gender. And she'll be able also to share her insights around advocacy, but also some of the key strategies of how we can actually work together to make sure that how we use comprehensive sexuality education as a key tool to address HIV and teenage pregnancies in Africa. Thank you very much. Over to you, Diana.
Thank you so much, Rahma. Actually, the last introduction, that is me. And I'm privileged to be one of the panelists. So I will use that opportunity to also share some insights that we have the conversation. I, however, want to introduce around 4 panelists, and one of which is Dr. Penina Itung. She is a medical director, and she is the Bureau Chief of Africa for AIDS Healthcare Foundation, that is AHF, where she provides strategic leadership and health systems management for AHF programs across 14 African countries. She has over 18 years of experience in public health And Dr. Penina has extensive expertise in managing comprehensive HIV/AIDS and ART programs, developing strategic partnerships, and collaborating at international, national, and community level. Our second speaker is Reverend Godson Kipavuvu. He is the Africa Reach co-chair and vice president of All Africa Council of Churches. He is a strong advocate for peace and the fight against HIV, promoting compassion and inclusion within religious communities. His recent work focuses on addressing gender-based violence, masculinities, and theological challenges related to HIV treatment, leading to the publication of several influential manuals and studies. And lastly, we have Trevor Emojel. He's a reigning Y+ king in Uganda and a national leader openly living with HIV. He serves as a country youth coordinator for AHF Uganda Cares, overseeing the Girls Act and Young People's Program under the Uganda network of people living with HIV. And so we look forward to having an interactive discussion with all our panelists. And at this juncture, I would like to start our program by inviting Dr. Penina to give the opening remarks, which you can also call as a keynote. And we are looking forward to hear from her in regards to the conversation of comprehensive sexuality education and how it is linking to HIV and teenage pregnancies. And from her speech, we shall still get some of the strategies, recommendations on how we can create an enabling environment for full implementation of comprehensive sexuality education as a preventive tool to prevent HIV and teenage pregnancies. So you're welcome, Dr. Penina, to give the opening remark.
Thank you very much, Diana and Rahma, for opening this session. And I want to thank all our partners and everyone present here this afternoon who is very interested in this topic. I think this is a topic that is very key for all of us as leaders, in this particular area and leaders who are leading young people. I really want to start by saying, Africa, we all know that Africa is the youngest continent globally, with 70% of our people being less than 30 years of age. And of that percentage, 40% are less than 15 years. That means our work is cut out for us in regards to what we can make available, whether it's for comprehensive sexuality education or any other area for young people. It also means that our continent requires us to plan and develop in all aspects of society, culturally, socioeconomically, politically, with our health security, you name it, with the young people at the center, because they are the generation that will lead Africa to a prosperous future. So today, together with our partners from UNAIDS and Education Plus, Africa Reach, UNFPA, and AHF, we gather here today to address an area that needs more attention generally, and more resources as well, at all levels of society, so that then comprehensive sexuality education becomes what is normal, a normal discussion and available, and information that is available to everyone within the society. So in our discussion today around comprehensive sexuality education as a tool that is empowering for young people to take charge of their sexual and reproductive health, based on age-appropriate information and knowledge, skills, tools, attitudes. We hope that this can enable our young people to prevent HIV and STIs, to avoid early pregnancy, to make better choices in their behavior, and to improve their interpersonal skills. In a brief reflection, in 2013, over 10 years ago, 20 countries signed the Ministerial Commitment on Comprehensive Sexuality Education, Sexual and Reproductive Health Services for Adolescents and Young People in East and Southern Africa. That helped to facilitate CSE adaptation and implementation and led to many more countries in the sub-Saharan region developing policies that support CSE implementation. However, in most countries, implementation has stalled. And really, this is because there is a lack of political will in most of our countries. There's a lack of dedicated funding by our national governments. If CSE is being funded in most countries, it is donor-driven, which does not make it sustainable. Equally, the recipients of CSC, who are the key stakeholders, the young people, are left out in most of the policy development and implementation. We also have disagreements or misunderstandings, or whatever term we can call it, in society about when we need to offer CSE. The disagreements are between the parents, religious leaders, different levels of community. So today, I hope that the panelists will lead us in a discussion about how we can draw more attention to CSE and create an enabling environment for its implementation. Some of the key barriers that we know are standing in the way that multiple countries face include, apart from what I mentioned earlier, also include sociocultural norms and values that stand in the way of CSE implementation, policy environments that either support CSE environment or do not support it, or there's just a lack of any policy around CSE in multiple countries, the lack of gender equal attitudes or norms that especially stand in the way for young women and girls in attaining higher levels of equity in whether it's in reproductive health or other areas of health, including HIV and AIDS services access. There's also a lack of empowerment of young people and a lack of engagement of young people on the whole, especially in our healthcare facilities. Stigma and discrimination as well in our healthcare facilities creates environments that are not empowering for young people to access services around sexual and reproductive health. The lack of social support and family support as well in most of our communities deters young people from seeking information when they really need it. So as we delve into the discussions in a little more detail from all the other panelists, I hope that we'll engage further to review these barriers and other areas that hinder CSE implementation and determine a way forward about how we can overcome them and be the advocates for change within our societies. So I welcome all of you into a detailed discussion, and I hope that we'll have further engagement in these areas. Thank you.
Thank you so much, Dr. Penina, for that beautiful opening remark, detailing the recommendation and highlighting areas where we need to pay attention to. I would like to, before Rahma comes in, I actually missed out an important key speaker that we are having today also, and that is Oluwakemi Gbadamosi. She is the Director for Advocacy, Policy and Marketing with AHF Africa, and she is one of the co-initiators and the Africa Bureau coordinator of the AHF Girls Act program. She's been active in communications and development for over a decade, working collaboratively with media, government, policymakers, civil society organizations, intergovernmental organizations, and communities to advance meaningful social change. So she prefers being called Kemi. So Kemi, you're welcome to this webinar, and we shall be looking forward to hear from you during the panel discussion. Over to you, Rahma.
Thank you very much, Diana. Next, we are honored to have with us Anne Gituku Shongwe. She's a director of UNAIDS Regional Support Team for Eastern and Southern Africa, and she'll be here with us presenting the new HIV update report for 2024, which provides a really critical insight towards the HIV perspective at large. But also, she's also going to cover some aspects around comprehensive sexuality in terms of response and strategies. So please, you're warmly welcome to the platform.
Thank you so much, Rahma. Thank you, Diana, and good afternoon to all the family in the house. It's wonderful to be together. I'm just recognizing that it's International Youth Day, so that's why we're taking advantage to have this conversation. So thank you to all. Let me see if Moses has put my slides up. Can you put them in slideshow, please? Thank you. And sorry that we have to do this. You know, this is our data world that we live in as UNAIDS, and we want to always show you our fancy graphs. So I hope you will be impressed, but more importantly, I hope that the information that I'll be sharing will be useful. So if we go to the next slide, this is our global update that we do annually, and we basically take a look from country to country, where are we, and globally what's going on. And so if you look at this first slide, I think the first message here is that the world is not where we expect it to be in terms of our HIV response. We're doing way much better in our region of East and Southern Africa, and you can see that you know, we're still off track, but we're doing better than most. So what we've seen from the number of people living with HIV is that Asia and Pacific, and the Pacific, the Caribbean, these other countries in the rest of the world, combined have less than what we have. In our region alone, we have 20.8 million people living with HIV. So we're about 50% of the global people living with HIV. We still have high levels of new infections in our region, and we still have AIDS-related deaths, but we have slowed down. And so we want to congratulate ourselves for that, and I'll show you in a little bit that we are making progress, but we're still off track for where we want to go. So if we go to the next slide, this again is showing our great progress. And if you look at East and Southern Africa, you'll be able to see that at minus 59%, we are doing really the best in terms of ending new HIV infections. And so some of this conversation we're having about CSE, we can already see some results the more that we're pushing it. As opposed to other regions, if you look at Middle East and North Africa, and you look at Eastern Europe and Latin America, you can see that actually for them, their new infections continue to rise. Then the next slide, we're looking at where are we in terms of our results. And I'm sorry to take you through so much details. I'll talk about CSE at the end. But just to share that we have mixed results. We're doing very well on testing and treatment. So the 95, 95, 95 targets that look at whether people know their HIV status, whether they take treatment, and whether they have viral suppression, we're doing much better in our region than in many other regions. And we have several of our countries who've achieved the global targets already. Zambia, Zimbabwe, Malawi, recently included Botswana, Eswatini. These countries have all been included, and Rwanda as the countries who've achieved the 95 targets. Many others of our countries are very close behind. They're not so far off. But I think what the aggregate information is useful for is that it gives us an overall picture, but it does mask the fact that there are differences. So on the right, anyway, you get to see the HIV testing and treatment targets. On the left, you see the prevention targets. We are lagging behind in prevention. This is why CSE is so important. So where we expected to be at reduced new infections to under 370,000, this year we were still at 1.3 million in the region. So we're still far off what it is that we expected to do. We expected to have reduced new HIV infections amongst girls and young women to 50,000, but we are at 210,000. So while we're doing well on the prevention, on the treatment side, we're not doing well as well on the prevention side. Next slide, please. I'll give you a little bit more detail on this, and then I will roll over 2 hours. If we can go to slide number 6, which gives you that image. Thank you. If we look at this image, what this tells us is who is getting infected. And if you look at that, on the left side, you will see, and I don't know, it's my left, maybe you're right. If you look at the data there, 15 to 24-year-old women, females, are 27%, 25 to 49 females are 27%. All in all, amongst women, amongst females in Eastern Southern Africa, we are at 62% of new infections are coming from women. The balance are coming from men. Again, even though I'm sharing this as men and women, of course, you know that there are non-binary men and women within this definition, but really just from a pure female and male, we are at 62% of all new infections amongst females, 38% among males, almost double what it is with males. Another important statistic is that 11% of all new HIV infections in our region are amongst children. This is of grave concern to us because one of the things that we have seen is a lot of new infections are coming from underage mothers. So it's not just that we have new infections amongst children, but we also have new infections from underage mothers. So the issue of teenage pregnancy, comprehensive sexuality education, SRHR access, all of this becomes important, and it plays out in who gets infected amongst children. The next graph is just a graph that shows you which country is doing the best or not. So when we think about CSE today, and as we talk about CSE, let's look at what the policies are in different countries and where there may be more or less flexibility in terms of comprehensive sexuality education, because we have evidence that when countries have stronger comprehensive sexuality education programs, whether we call them CSE or not, that we make progress. So you can see in some countries, they're called life skills education. In other countries, it's called family education. There's all kinds of names, but where there are strong programs of CSE, like Zimbabwe, we have some in most of Kenya, in Malawi, and so on, you then have better results in terms of prevention. So, it's just one of the indicators. It's not the total indicator, because like a country like Namibia and South Africa, yes, they have CSE in their countries, but there are other factors, obviously. What are the levels of sexual violence? What's going on in terms of transactional sex? There's other factors. But we do know that CSE is a factor here, and some countries are doing better than others. And then I'm going to just go quickly. This is just showing us the HIV testing and the fact that we have a gap. I think I've already talked about this, and I've talked about the fact that Botswana, Eswatini, Kenya, Malawi, Rwanda, Zambia, and Zimbabwe have all achieved these 95 targets. Back to the issue of children. This is a big issue for us and a big concern in this global update, because what we've seen is that while the adults are doing better, we are doing better amongst ourselves, we're not doing better in terms of children. And so while adults are averaging at about 90%, the children are averaging around between 60 and 70% in terms of their performance. So there is huge concern about being able to reach children. I'm going to skip to slide 13, if you could, please.
Okay, I was just going to say I've lost track of what slide you're on.
Yeah, that was the slide there. Okay, there. Go to the next one now. Yes. Yeah, that's the right one. So here we are emphasizing again the issue of 27% of all new infections in our region are amongst adolescent girls and young women. This figure shows us that girls and young women of this age group, between 15 to 24, are 3 times as likely to acquire HIV than their male counterparts. This figure changes from countries. You will find, I remember we got a figure, the highest we had heard was 11 times more in Cameroon. In Botswana, I believe the number is about 7. Eswatini is about 5. So country by country, 5 times more infections of girls than it is with male counterparts. So even as we think about CSC, we cannot assume that the information that we're giving to men and women, to male and female, is the same, because of the kind of vulnerability that there is. If we go to that next slide, you actually see what the numbers are in terms of the differences. So the estimated number of new infections per week amongst 15 to 24-year-olds versus the males. In our region, it's 2,372 girls who are infected weekly versus 722 young men who are infected weekly. So, and you can see your country, where we are. You can see the blue line is showing what's happening with males of that age group. The red line is female. So you can see what the differences are. And so as you think about CSE today, think about how do we differentiate that. The next slide is showing the same thing, just really with numbers. And so we can skip that and go to slide 17. I don't know if you can see that, Moses. I'm sorry, I'm just trying to go through this so that I don't have to keep everybody on that slide. So on that slide, one of the things that we started to do at UNAIDS with all our co-sponsor partners was begin to say the work that we have been doing to date has been largely biomedical in its response. Let's make sure we have PrEP in the hands of young people. Let's make sure that, you know, there's male circumcision, that condoms are distributed. But what we now know, and from the work that all of you in this room, I think, do, is that there are real societal and structural barriers that are actually the reason that are driving HIV, that are driving the underage pregnancies. And so we've developed targets that are not just about these treatment targets, but targets that are looking at gender-based violence, that are looking at stigma and discrimination, that are looking at legal barriers, that are looking at the role of community organizations in engaging and making sure that there is absolute engagement and leadership by communities themselves. And CSC is one of those areas that we have included in these targets, not as CSC, but really as we look at these targets, we're looking at how do we make sure that we're able to respond to the challenges that we're all confronted with. So addressing structural barriers, gender transformative interventions are critical to add to what was already a biomedical response. And then the last slide that I'm just going to, again, look at what you know about our Education Plus initiative, is that we have the plus in the Education Plus. And what we're saying is that with Education Plus, keep girls in school to the end of secondary school, because we know that keeping them in secondary school to the end of secondary school reduces their chances of HIV infection by 50%, of underage pregnancy by 75%. And that in order to, by keeping them in school. But resources are so constrained that they tend not to be prioritized. And so girls are not staying in school to the end of school in many of our countries. And that's a big campaign that we need to push for. But while they're in school, what happens to them? This is where the comprehensive sexuality education comes in. How do we ensure that every girl who goes to school and stays in school to the end of secondary school has access to the latest, the most important information on comprehensive sexuality, right? That they need to know. How do we make sure that in and around the schools, that around the homes, that there is access to sexual and reproductive health and rights? In some countries, in some regions, even within South Africa where we are, and in some of our countries, you find that there are actual SRH clinics that are positioned close to the schools so everybody has access to them. And then the prevention of violence against women is another very important point, because we know that there is high experience of violence amongst our women and girls. So in this global update, and I'll stop here and just give one more comment really, is that no, I'm done now, Moses. You can go to the last slide if you want. But what we concluded in this is that we are the last slide, the very last one. You were there. Yes, there. Is that AIDS is at a crossroads. And I would say the same for for the work that we're doing and we're discussing today on comprehensive sexuality education. We are at a crossroads. We are at a time when we are experiencing pushback, human rights pushback against sexual and reproductive health and rights. We know that in many of our countries, comprehensive sexuality education has not been accepted by many of our communities. We have pushback, whether it's from traditional religious leaders in some instances or just political leadership who believe this is an externally imposed curriculum. And yet we say that comprehensive sexuality education should be culturally and locally relevant in order for it to be put into the school curriculum. But we are at a crossroads because we're not at the targets that we expected to do. There is urgency now to deal with the fact that resources are no longer available for us to respond to AIDS SRHR as they have been. And we're now at a time when leaders have to take some very strategic decisions, and leaders in communities, leaders at a political level, to determine whether or not we want to change the trajectory of the responses in our countries. Do we want to see a future where girls and young women, where our young men have access to the opportunities that are available to them? Or are we going to sit and accept the kind of pushback that we're seeing in our countries? So as we deliberate today, think about the fact that human rights pushback is a major issue for us, that resource constraints are a big issue for us, and that there is an opportunity, at least for HIV. There is an opportunity now because there's long-acting PrEP that is now made available. It's too expensive for us. It's $40,000. We need it at $40. It is too expensive for most of us. The technology is there. The science is there. The willingness and the global political willingness to get us to where we need to is what we are focusing on. And this is what was the key message of this global update. So over to you, and looking forward to hearing more from each of you. Thank you.
Sure. Thank you so much, Anne, for taking us through this powerful presentation. The data presented before us is meant to inform our actions, and implementation of policies, programs, and so it is before us. We are supposed to take action, and part of this discussion is to hear out from different speakers on what next. I wanted to actually relate this conversation to the main discussion around using comprehensive sexuality education as a prevention tool to mitigate HIV infections and teenage pregnancies. That people who have sat down to define comprehensive sexuality education recognized, under various terms, and they're looking at it as a prevention education, for it as a tool that is providing life skills education, a tool that provides comprehensive sexual and reproductive health education. And this tool has been embraced in various countries and at different levels. Some countries have been able to integrate it into different programs, education curriculums, not in a very comprehensive way. One of the challenges that that we are facing is that there is limited information within the curriculums, those who have been able to integrate it. And some others, like Anne mentioned, they call it life skills. And when you go into the details of the curriculum, it is not providing all information or comprehensive information, age-appropriate information that young people would still require, or interventions that young people would still require to be informed about the different health aspects about their lives, for them to be able to make informed choices. And one of the reasons as to why this comprehensive sexuality education or frameworks or policies are either stagnant or failing to take off in most of the African countries, one of the reasons is that we have pushbacks from different groups within the different countries. Some are political leaders, some are parents, some are cultural leaders, and some are faith institutions that do not align their values with comprehensive sexuality education. So this actually takes us to the next conversation, where we have panelists, and the discussion or the panel question is going to look at the role of faith leaders and parents in demystifying and creating an enabling environment for comprehensive sexuality education as a preventive tool for HIV and teenage pregnancies. So at this point in time, I want to ready my panelists, and I want to look at Kemi, I want to look at Trevor, Reverend Godson, and Maria. We are going to discuss, everyone is going to give us insights on the role of faith leaders and parents in demystifying and creating an enabling environment for CSE. We would like to hear from every one of you, starting with Reverend Godson. What are some of your insights on the role of faith leaders and parents in demystifying and creating? We have had your biography, you have participated, you have led conversations, you have developed manuals in line with the current conversation before us. We would like to hear from you, and being a faith leader, what do you think would be the role beyond just an individual who yourself was representing yourself in this conversation? What would be the role of faith leaders and parents in demystifying and creating an enabling environment for CSE? You have between 4 to 5 minutes to share your insights about this. You're welcome, Reverend Godson.
Thank you very much. My English is not very good because I'm French-speaking person, but I will try to communicate with you. I am very happy for inviting me to this meeting. And I would like to say that Africa Reach is one of the organization in Africa working with the faith leaders and religious institutions. And as far as the CSC is concerned, we as a church leaders, as religious leaders, we are a little bit reluctant on the methodology that the UNDP and UN offices use in our various countries, because we were not very informed about what is really CSC. And also, the majority of the religious institution or leaders are not informed about the protocol that we have, especially, for instance, the Maputo protocol and the protocol on the protection of children. So when we are talking about CSC, we need to know the legal framework in our country, in our sub-region, because in West Africa, we have ECOWAS. So if we know as church leaders, these protocols and this legal framework, we can easily work on CSE. And what I would like to say is that by working on CSA activities in West Africa, one of the advantage is to work with the media. And in our region, the Muslim component and the Christian component, they have their own media. So we can take, or we are taking advantage from the media to share the values of CSE. And other point is that we cannot talk about CSE on our own, like we are UNDP, we are UNAID, we are church, we are Muslims. We have to work on CSE on an ecumenical and interreligious approaches. So if you use ecumenical approaches, I think that we can also impact people. And one of the aspects that I would like to make emphasis on is we as the church leaders and the religious leaders, we don't have CSC in the curricula of the theological colleges. So we need to journey with UNDP, UNAID to have a partnership so that we will put the CSC activities in our training of those who are coming to be or going to be the leaders tomorrow or in 2 or 3 years. So we need to incorporate or integrate it in the agenda and the curricula right now. And especially we have the what we call in our church the Sunday school activities. So we can revise our catechism and the Sunday school activities to incorporate or to put in the issue or the reality of CSE and sexual education. And second aspect is that we don't have raw materials on the age-appropriate program on CSE. So this material is still lacking in our activities, and I think that it is also important to take it into consideration. And we need to involve religious leaders because they are parents in the development and implementation of the programs. The majority of the programs in CSE in our countries is done by civil society organization. But when we come to the church and the mosque, these are the people who respect us, who can follow what we are saying. Why not designing program for training of religious leaders in order to understand the whole component, the whole package of CSE, so that they will be able to multiply it or share it in their sermons and their homilies. And also, it is important to help religious leaders to create a safe space to talk about sex, especially the intergenerational safe space for adolescent and church leaders and also women's leaders. And for instance, I would like to say that, to conclude that, we need to integrate comprehensive sexuality education into religious education program. Comprehensive sexuality education can be integrated into existing religious education program like catechism, Sunday school, addressing topics such as sexual morality, family values, and healthy relationship. These are some of the points that I would like to highlight, and I think that we will have time also to discuss during this meeting. Thank you very much.
Sure. Thank you so much, Reverend Godson, for your insights. And I would like to invite the next speaker to share their insights. I would actually interest the next speaker, who is Kemi, to share her insights, also reflect on some of the challenges that Reverend Godson has raised, one of which is them not knowing about the regional protocols like the ICPD and all that. So as you respond to, as you share your insights about the role of religious leaders and parents, kindly also hint on it. You're welcome, Kemi, to respond to the theme.
Thank you very much, Diana, and it's such a pleasure to be here. So you're right when Reverend Godson talks about the fact that a lot of our religious leaders, community gatekeepers or community leaders, as it were, even traditional leaders, do not have the relevant information. And that's because a lot of times we do assume that they would understand and they know. But again, given that we live in cultural climes, we live in climes that are led by cultural beliefs or norms or issues around gender norms, it becomes very important that when we talk about contentious issues such as CSE, we have to make available not just education for traditional leaders or community leaders or community gatekeepers. We have to also ensure that we identify people amongst them that can help to drive the message across. So we have someone like Reverend Godson who is joining us in this conversation, and it is strategic. It's strategic because even amongst these leaders, there are people who understand that some issues such as CSE are very critical, not just only for young people's advancement and well-being, but also for the entire community well-being. So when we look at messaging, I like that he highlighted on messaging. It's also thinking again, how do we make CSE contextual, whether it's to the traditions, whether it's to the culture, whether it's to religion, like he talked about. And when we do that, is now going into the process of breaking down the messaging in a way that resonates with the communities. Now, how do they understand what the Maputo Protocol is? How would a community leader know what CSE is? We need to also ensure that we're able to talk to CSE or speak to CSE or tailor it in a way that it speaks to the cultural context. And sometimes it's as simple as translation. It's as simple as ensuring that the language resonates with the people. I remember a time at AHF where we were looking at some policies, for example, around stigma and discrimination in HIV. And some of the things that we had gone ahead to do as an organization was, how could we break down stigma-related policies in a number of our countries in a way that even the layman understands it, in a way that the community understands it, using visuals, using illustrations that resonates with the community, translating it to the local languages, engaging them in forums and discussions. These are steps that I think we are failing, or we haven't yet gotten to that point. And that's why conversations such as these are very, very critical for us to have. We're leaving the communities behind. It's one thing to have inclusion, which is important, because recognizing the role that community leaders and religious leaders have when it comes to comprehensive sexuality education is the first step. The next step is also, how do we get them to understand that CSE also aligns with some of the cultural values, for example, respect, for example, mutual cooperation, consent. These are things, protection of community values. These are things that, if we look at the CSE curriculums or we look at the life skills education, there are areas that align with those. And can we begin to start from that point as a way to get buy-in from them in terms of messaging? So it's important that I feel like when it comes to CSE, in many ways, we have put the cart before the horse. But one thing I'm happy about is that we are redirecting our steps now as a collective to see that traditional community leaders, religious leaders are very key. So when we talk about, meeting them in churches, meeting them in their communities, breaking down the information and the language in the way that they understand, in a way that doesn't seem as a threat to the cultural values that they uphold, but promoting and framing it as a tool for empowerment for young people, as a tool for protection of communities and advancement, then it is easier to get a buy-in. And I think another thing that is important when we talk about CSE and leaders is what I call the incremental approach. Because CSE is very contentious and controversial, one thing we have to learn to do as well that is very critical as we engage this particular group is to use the incremental approach. And what that simply means is starting with the less contentious or the less controversial discussions, because we're trying to build trust. We're trying to get understanding from the communities to get buy-in. So we want to start with easier things like respect. We want to start with easier things like hygiene. It makes me remember a time when one of our country programs in AHF was about to go into a community. First, they identified the community leaders who were very key. And they went through the process of educating, raising awareness, identifying champions amongst them that could help amplify the discussion. But they didn't stop there. They decided instead, what is the best entry point? And that's the good thing about inclusion of community leaders or traditional leaders and religious leaders, is that they give you insight into what would work best for the community. Of course, without compromising the quality and the integrity of the knowledge that we intend to share, especially around CSE, given that we have the stories, the research, the studies to show that it works. They used menstrual health as an entry point into CSE conversation. And that's what an incremental approach is. So you start from the less controversial, and then you begin to build on it as trust builds to now introduce the more controversial topics. And still on messaging, still on whether policy framing or breaking down policies in a way that communities understand. I think one thing that we need to do better at is, how do we tell the stories of the successes of CSE even at community level? This is very critical for us. People understand, people believe what they see. People believe what they see works. And we know that CSE works, but we also need to tell that story even more. We need to highlight it, whether it's through the media, whether it's through influencers. We need to be able to tell the story that CSE does work, especially for young people and even for communities. And just to wrap up, when we talk about equipping religious leaders or traditional leaders and communities about the efficacy and just how effective CSE is for us, whether with HIV, we need to also highlight what are the benefits. A lot of times we talk about CSE, but we don't project or speak on the benefits very strongly, especially with community leaders, religious leaders, and traditional leaders, where we get a lot of pushbacks, even parents. So it's important that the messaging highlights the benefits of CSE, such as its contribution to improved health outcomes, such as its contribution to reducing teenage pregnancies, its contribution to GBV, addressing GBV issues and reducing that in the community. So these are some of the ways that I think, even as we continue to engage and try to create an enabling environment, it is one, ensuring that the communities that we are reaching understand what we're talking about. Most times we operate from our level of perception, what we understand, even in the development field. We have a lot of lingos that sometimes do not resonate at community level, or doesn't even resonate with the religious leaders or the traditional leaders that we work with. And it's important that as we continue to build this movement and to try to galvanize the change that we want to see when it comes to CSE in our communities, that we remember that the community voice is in how we shape the messages, how we frame, or how we break down and translate the information is also very, very critical. And Diana, if I may just also speak on the fact that, for example, I will speak from a civil society space on what civil society can also do even more.
1 minute.
With respect to breaking down information and engaging community leaders, is the fact that it's an example of what we're doing here. But I would say that we need to have more of these dialogues and these conversations, and even educating our community leaders on the different policies that exist at the community level. Having the discussions. This is great. What we're doing now is great because we're reaching a number of people. But even as civil society, we have that responsibility to be able to take the conversations right to the heart of the community. We need to take the conversation, whether it's in community dialogues or forums, where we help them understand. And most times when we're building capacity, we need to also engage and ensure that the capacities of religious leaders or community leaders and traditional leaders are built as well. Because when they understand the issue better, when it resonates with them and their people, buy-in becomes easier. And then you have champions like the Reverend Godson, who now amplify the cause. And that's what we want. We want more people to see the benefits, understand the benefits of CSE, and join us in advocating for CSE for young people. Thank you.
Sure. Thank you so much, Kemi, for sharing with us those insights. It's very clear. You are sharing with us tactics and entry points on how we can penetrate into the faith, the religious space, and have them play a very critical role in supporting the implementation of comprehensive sexuality education. You mentioned around issues of messaging. I think it's very key. You mentioned about tactics like engaging in issues of menstrual hygiene, but I also know that religious institutions have programs, including youth-related programs. They have health-related programs. How do we work with such programs? And, he spoke about capacity building, which you also talked about, and breaking down the message of comprehensive sexuality education in the language that they understand. And we take note of those insights that you have shared with us, and we hope that all players on this webinar are taking note, and we look forward to having an interactive discussion later on. I want to just announce that if you have a question, please keep it in the chat so that when we get to the time of question and answer, again, we don't go into raising hands. So we encourage all participants, if you have a question, please raise it. At this point in time, I would like to invite Trevor, one of our most important speaker, representative of the young people. the statistics, of course, put him in the spotlight as a young person, because the conversation today is really focusing on young people as one of the vulnerable group currently when we talk about issues of HIV, new infections, and teenage pregnancies. Trevor, what's your take on the role of faith leaders and parents in them playing a critical role in supporting a full implementation of comprehensive sexuality education as a preventative tool? Please come through.
Thank you so much, Diana. I want to appreciate that our speakers have really spoken with passion towards the subject. And I'm also very, very, very interested in this discussion because even in my country, comprehensive sexuality education, our advocacy is present from different levels, right? From the high level discussions when we are meeting with policymakers, but also to community level where we meet our parents, faith leaders. So at the end of the day, pushing for comprehensive sexuality education is very important for us because we understand the benefits. And I think that is what my submission is going to be largely sharing. So to begin with, I want to begin my delivery by pointing out to one huge misconception that I've encountered in my advocacy and what we do here in Uganda. So there is a big misconception of understanding comprehensive sexuality education. So we have incidences where people call comprehensive sexuality education sex education. I want to let all the people on the call know that these are two different things, and sex education is only a component of comprehensive sexuality education. And even when delivered, it is done age appropriately. So it is not like we are going to come to your 5-year-old child and speak to them about how to use a condom or how to have sex at that age. It is not what comprehensive sexuality is about. And I believe this is what has also raised resistance towards the subject. So one misconception is that comprehensive sexuality education increases sexual activity. I want to reliably inform everyone on the call that it's actually the contrary. Research actually shows that comprehensive sexuality education delays sexual activity. Why? Because it promotes safer sex behaviors. So at the end of the day, when young people are empowered to understand what is the right age for sexual debut, how do we navigate healthy relationships, how do we do all these important things, you will find that they are able to responsibly have sex when it is actually the right time. And then secondly, it is that comprehensive sexuality education is inappropriate in terms of the age. Like I mentioned, we are not going to approach your 5-7-year-old child with information on, for example, how to use a condom. For this child, we are going to speak to them about bodily autonomy, respect, like one of the speakers mentioned. How do you recognize inappropriate behavior, for example, unsafe touches? Or how do you also respect the borders of your body? How do you strengthen leadership of your own body, your own sexuality, so that at the end of the day, this is a young person that is empowered. We do not want young people to grow up with more questions that should have been answered at a younger age, but now because they're adults and we didn't expose them to this information, they are getting the wrong answers. And so that is a situation that we want to correct and address with comprehensive sexuality education. I want to speak to the parents on the call because I'm a young person and I believe we really want you to listen to this. So the parents that eliminating or have considered talking about sexuality education in your house an abomination, I want to let you know that you are increasing the vulnerability of your young people to misinformation. In the age where we have an influx of information on the internet, information from peers, from wrong groups, you are leaving your young person or your child in a very dangerous playing field where they are going to have access to the most wrong information because as a parent, as a very critical stakeholder that we actually hold in very high esteem, you're not playing your role. So this child that probably, if it's a religious home, this child that needs service, this child that is always probably reading the Bible like you see. And by the way, one very interesting technique is that young people, we've learned how to show such parents what they want to see. So if we know you're this very strict parent that only wants to see a child serious, we've mastered your routine and your expectations. So at the end of the day, because you're not fostering an open communication with your child, you're going to miss the important concept. So You will be shocked when you hear that this girl that looks very religious is now pregnant or has gotten HIV. But at the end of the day, it's not entirely the child's fault because you didn't introduce this very important conversation from your angle, because as young people, we really respect what our parents tell us. So it is a message for our parents on the call to actually have this conversation with young people, because you're closing the tap of so many vulnerabilities. And that is something that we really want to see. Then lastly, I would like to, I believe time is,
Yes,
I would
Trevor,
like to
1
now,
minute.
yeah, I would like to now move to the contribution on the roles that we have as parents, the religious leaders, and as young people. Like mentioned already, facilitating open dialogue. We want the religious leaders to actually know that we're on the same page here, and CSE's values are compatible with your values as the house, because we also look at respect, we look at healthy and stable families. We are also in that mode. So we are not probably coming with something moral, secular. We are in the same spirit. And then we want involvement in the process, secondly, as young people, but also as religious. I believe that it will be more embraced if we have religious leaders playing a role in the development of this content, because then they will not say, oh no, we do not have ownership of this document. But when we all have ownership of the documents, and also young people, we really want to see our participation there as well, so that we are also guiding the people making this document in our particular needs and interests. And then lastly, starting where you are. I like when our Reverend mentioned that they have Sunday school and seminars. I have been in churches where we actually have seminars where they're speaking about navigating relationships as young people, or yes, something within that. So you can have these discussions and channel HIV prevention there, so that at the end of the day, there is discussion ongoing for the young person who is a Christian, for the young person who is Muslim, and at the end of the day, we are able to achieve the benefits of CSE. Because of time, I beg to submit here, but we'll be contributing further. Thank you so much.
Sure. Thank you so much, Trevor. You have another opportunity in the second round of questions, but thank you so much for your submission. You have been very clear. If you want faith leaders or religious leaders participate in this, involve them in the development, address issues of misconception around sexuality education, and then the role of parents, in this has been also talked about. The question is, do also parents understand sexuality education? In this first round of question, I want to invite Maria, who is a sexuality education expert. She has done this for the last 10 years. And Maria, there are a number of things that still lack clarity. And as an expert in that area, how do we make sure that we provide clarity in this area to catalyze, participation and action from the faith leaders and parents to support full implementation of comprehensive sexuality education, across the board? You're welcome, Maria.
Thank you very much for having me on this webinar. As you heard, I'm from UNFPA East and Southern Africa Regional Office, where I've been here for 10 years, but I've been doing sexuality education for over 30 years, even before it was called CSE. And there's a whole history around the terminology. But one thing a lot of my panelists, colleagues have mentioned a lot of the points I would have also raised. And just to get back to the fundamental issue that partnerships are key. If we look at anything we do with and for young people, they are our primary partner. The true partnerships with young people are fundamental, but equally so are the partnerships with parents. We all recognize that parents are the primary sexuality educators of their children, and it's their right and their privilege and to instill those values and attitudes, just as religious or faith-based organizations and going to church or mosque also play a very important role in the formation of values and attitudes that impact all sorts of things in our lives, our gender roles and responsibilities, our ideas about families, ideas about relationships, and all that. And that one would never, in terms of lessons learned, we would never go into either a school or a community setup without establishing and orienting and ensuring that parents and community leaders know what the intentions are with sexuality education. And with that, contrary to what is the louder noise out there around opposition and anti-rights, and that's all real and something we're contending with on a regular basis. But the silent majority are parents who are really appreciative that we're joining them or even doing it for them in terms of making sure their young people get the right information at the right time in the right way. And when I say right, I mean in a way that fosters critical thinking for young people and life skills that will serve them in life far beyond only their sexual and reproductive health life, whether it's for the job market, whether it's for relationships of all types, the life skills imparted in sexuality education are really, really universal in one's life and very valuable. And so, parents and community leaders, faith-based leaders, traditional leaders, there's a lot of misconception around even the roles of traditional forms of sexuality education, where, throughout the African continent, I am a scholar of sexuality, but also of cultural values and gender, of sexuality, etc., of the continent. And there were many, many forms of traditional sexuality education that were very conducive to health and well-being. And so, getting back to those connections and getting back to Reverend Godson's point around, how do we go back to theology and find the common narrative, right? So the common narrative, I would like to think, is that we all want our young people to be healthy, safe, productive citizens, with their full potential realized. So the partnerships are absolutely critical, but meaningful partnerships. The second area I would want to talk about is really around kind of the implementation modalities, how we're actually bringing the content to young people. And we know for sure that you need trained educators, whether they're teachers or whether they're community-based facilitators, making sure that they have the content and the skills to deliver the information in a way that enables that critical thinking and all that is important. And, when we heard about when Anne talked about Education Plus and this whole idea that schools are protective for girls, we still know we're living in a reality where about half of our African youth are not attending schools. And so, first of all, we need to make sure we provide universal access to sexuality education. So whether it's done in a formal classroom or as an extracurricular activity within the school setup or in communities, whether it's a part of a Sunday school, whether it's part of sports groups, or whether it's connected to health facilities or a number of community spaces, that we need to do both. We cannot leave anyone behind. And that's where you'll find the most vulnerable young people who may not be in school, the poorest of the poor, the young people with disabilities, the young people living with HIV, et cetera, the young people in humanitarian contexts that are in the move and have a very uncertain, unstable day-to-day life, right? So, and then when we talk a little bit more around the content aspects, one of those contentious issues that we hear about sexuality is, oh, you're going to teach our young people how to have sex. Well, when we look at age relevance and age appropriateness in the content, in when it's delivered, it becomes very clear that young people need the information before they actually need it. In other words, this idea that abstinence, for example, is something that is very much a part of sexuality education. And it is the primary method discussed as a way to keep oneself safe from HIV, unintended pregnancies, avoiding unprotected sex and all that. But the difference with
Maria, you have a
sexuality
minute.
education, okay, thank you, is that it's positioning abstinence as if it's not forever. At some stage, a young person will transition from being abstinent and wanting to, as part of natural development, kind of sexual development, will want to engage in relationship with other people. Okay. I mean, there's a lot I wanted to say, but what I wanted to say in closing is that the power of sexuality education, that we need to continue to give a long-term view and build that evidence base, is its potential to create healthy behaviors over the formative years of a young person's life versus the need for behavior change. And this is a very important distinction. We have the opportunity collectively in partnership with all the values and attitudes and opportunities for young people to ascertain for themselves what is a harmful cultural practice, what are the good aspects of culture, et cetera, to develop healthy behaviors before they actually need to change any behaviors. I will close there. Thank you very much.
Sure. Thank you so much, Mary, for your submission. I take a few things that are very critical. Parents are primary educators of sexuality education. The question is, do we have a parent guide? You mentioned parents are the silent majority, but you also mentioned that what you asked a question of what are the commonalities. We want young people who are healthy, everyone. If you have a child, someone you're taking care of, you don't want to see them pregnant, you don't want them sick, you don't want them to have STIs, you don't want them. So if we have those same commonalities, how do we come together to foster, collective action in addressing issues that are affecting young people? But I want us to go into another round of questions. I know this second round is going to be managed by Rahma, but I believe that most of the things we have still spoken about them in this first set of questions. So in the next round, we would really expect that we use around 3 minutes for each of the speakers. And so I'll hand over to Rahma to share those questions with the panelists. Yes, Rahma.
Thank you very much, Diana, and thank you everyone for your very insightful thoughts towards the topic. And I would like to point out this question directly to our faith leader. So given the significant influence of faith leaders in many communities, how can we be more effectively engaged to support the promote of CSE as a tool as a tool for prevention of HIV and teenage pregnancies? We know that there are a lot of obstacles in different communities, especially the limiting beliefs, and this is actually connected to different beliefs and faiths. So what is your take on this particular question? Sorry, you're muted.
Yeah, thank you very much. Fortunately, last April we met in Lome, faith leaders, Muslims and Christians. We met in Lome and we talked about the issue of CSE. One of the problems that we are facing is that those who are involved in CSE activities, they are not inclusive. They thought from the beginning that religious leaders will not accept. But you cannot imagine the pain that we face when we realize that one of our daughters gets pregnant before marriage. This means that something is wrong in the education that we as church leaders or religious leaders, we are giving to our children. So we also need a factual training on the real facts and the methodology to communicate on CSE. And also, we need to create confidence and trust. There is this kind of suspicion between faith leaders and those who are in CSE activities, and this is like from the beginning of HIV, when we were talking about HIV activities, they thought, okay, the church leaders, the faith leaders will not accept the sensitization process. And at the end of the day, when we are affected, we came to them and tell them that, please, can you help us? Now, today, we are willing to have a formal partnership between UNDP, between UNSAID, between all the partners to help the faith leaders in order to understand, in order to have a common language, and also in order to have a program, because we need to correct the language. The language that is used in the religious setting is different, but the result will be the same. So please, can you help us so that we will elaborate messages, languages, in order to sensitize people, to train people, to educate people on CSE with our own comprehension of the system, of the fact, with our own approach, with our own understanding. This is the main issue today. Thank you.
Thank you very much for your for all these insights. I would like to have a follow-up.
Excuse me, can I add something? I would like to share quickly with you, when we met last time, one of the points that we mentioned. When we met in April, one of the points we mentioned is how to help our children to organize their menstruation. I don't know if it is English. The menstruation. Hello?
Yes, Reverend?
Yeah, is it English? The menstruation of our adolescents, how to use hygiene of their, yeah. So because it's and also we talked about improving knowledge on genitalia and also genital hygiene. That's what we talk about as religious leaders. Family planning, how to work on family planning in taking into account our values, and how best to educate and raise awareness among young people about sex health. These are the topics that we mentioned last time in April. So this means that we need you, and also you need us in order to break down the message and also to contextualize the message. Thank you.
Thank you very much. And I've been noticing from your insight, like you've highly highlighted the aspect of inclusivity, and we actually encourage like, as I said before, like this platform also is trying to create a platform where we can actually come together and brainstorm all these ideas and making sure that we reach out to our common goal. But it's also important as well throughout your engagement with other stakeholders, including other religious leaders, to make sure that you also try to include parents and the young people themselves to be able to give out their own insights on how they would like to receive all those kind of information. So that's very, very, very important. And the aspect of education, because we all know that education is the most powerful weapon that we can use to change the world. And that's why we also have all these sessions to make sure that we share our learnings and insights. Thank you very much for that. And I think I'll just go directly to another panelist. As a young person, I know like you have a lot of experiences working in the community, but I also know like we have a lot of commonalities in different communities in terms of implementation of comprehensive sexuality education. So I'd like to know from you, Trevor, how can youth advocate better partner with different stakeholders, but also ensuring that how we engage effectively with religious and traditional leaders in our own capacities? Trevor?
Trevor, you're muted.
Okay, as we're waiting for Trevor, I'd just like to remind everyone If you have any question, please make sure you engage with us via our chat box. Any kind of suggestion as well, please feel free to engage with us. Thank you very much. Trevor?
Can you hear me?
Yes.
Okay.
3 minutes, Trevor, 3 minutes.
Yes. Kindly pardon the question. I think I had network glitch.
Okay. I wanted to understand, as a youth advocate, how can we better engage with religious but also traditional leaders effectively in terms of implementation of comprehensive sexuality education? I know you've mentioned some of the challenges that we are facing and in our communities, but what is your perception around these kind of partnership? Like, how can we best work together?
Thank you so much. Yes, returning to this very important conversation, I believe a lot was said in the previous submission, but I'm going to just reflect on the experience and what we have done so far as advocates in Uganda. So very specifically, we have come up with what we call a diverse dialogue meeting, where we have particular stakeholders that we want the conversation to go to, also be a part of the discussion, so that we can have open dialogues and understand from their end what really are the barriers from their end, and what is stopping that stakeholder from fully participating in CSE. So, for example, I'll just give an example. One time, a religious leader mentioned that you are speaking about them engaging, but his imam in one of the mosques does not have the information, to share with the congregation. So it is important that we also engage them in the training and the capacity building, so that they are able to share this information with confidence, because they also do not want to give wrong information to their audiences. So that is why there is a little bit of a pushback and not wanting to fully engage. And then secondly, what we have done is penetrating spaces. I don't know if we are also talking about schools here, but we've worked with student bodies to ensure that sexuality education is something that can be embraced. We've engaged with the youth bodies that we have in Uganda, student bodies, just to ensure that this conversation is fully understood. But when it comes to community, we also know that the people in the community believe a lot to their community leaders. So we have called upon we have the local councillors. The structure in Uganda, I think, is a bit peculiar to Uganda, but we have engaged them in a way that if they have their council meetings, or if they have those town hall meetings, they can have a conversation or two on CSE, so that the conversation is brought up in pieces, but also that people are used to hearing this conversation. We do not want it to be alien, and the only place probably we are hearing it from, I don't even know, but we want it in a way that the conversation is widely spread and all stakeholders have a role to play. And then for us as young people, our Girls Act and YPP, we are doing it very strongly. I must say that our young people are using the peer-led approach to speak to fellow young people in various aspects in terms of menstruation, youth health, how to deal with HIV, contraception, family planning, among others. So for us on the youth end, we are really playing our part. But at the end of the day, it is a multi-stakeholder effort that can really bring to fruition the full benefits of CSE that we want to see. So at the end of the day, we want a multi-sectoral approach to CSE, so that, yes, the holistic society is really fully involved, and young people have access to this information wherever they go. I believe that's what I had to submit. Thank you.
Oh, thank you so much, Trevor, for your submission. And the next question goes to Kemi. And we are wondering where, for example, cultural taboos and gender inequalities are deeply ingrained. How can we leverage on advocacy, work with community leaders and influencers to create a more supportive environment for CSE implementation? Kindly use 3 minutes to respond to that.
Thank you very
Yes,
much,
Kemi.
Diana. Thank you. I think when we talk about cultural taboos and gender inequality, a lot of what we've started off this conversation with gives us insights. But one thing I'd like to highlight when dealing in such situations is the need for cultural sensitivity and adaptation. As we work with community leaders, cultural leaders, or parents, and even whether it's schools, because schools are also products of our communities, schools are situated in communities, it is important that we tailor the content of CSE in a way that, it speaks to local or cultural values. And in as much as we do that, we also have to ensure that we do not compromise the core principles of comprehensive sexuality education. So there are areas of overlap when we look at CSE. I talked about it earlier, and I think we've heard that even from Reverend Godson, Maria, and Trevor, and that's issues such as respect. Discussions around respect, responsibility, well-being, those are things that are within the cultural values. I don't know any community that doesn't want to see its young people, have an overall well-being. So we need to also learn to use that in terms of adaptation, so that way it speaks to the people. You get buy-in as we do advocacy, because once communities feel that what you present is a threat to the culture that they uphold or the values they uphold, the instant reaction you get is a pushback. We've talked about inclusion, which is very key. And this is something that we continue to work on to ensure that, the key community gatekeepers, starting from parents and leaders, they are part of the conversation. And number two is also when we talk about ways of integration. I remember one time in Sierra Leone where they had to pull out references in the Bible and the Quran to try to bring out the fact that stigma, even in the Bible and the Quran, there are places where it speaks against things like stigma and discrimination. I think we need to do that. As I hear Reverend Godson speak, it makes me realize that we need to do a bit more of that. We need to integrate religious and cultural perspectives where possible, where we can, in the teachings that we do with CSE. What are some of the areas of the Bible or the Quran or the cultural values that align with the principles of CSE? Those are things that we need to highlight as we try to engage communities and address issues of cultural taboo. Life skills is something that, it seems to sit well with everyone. When we talk, and that's why in a number of countries or climes, you see that CSE has different names. Now, whatever that name is, it's the strategy behind it, using that to get buy-in, using that to ensure that we get to transfer the knowledge of CSE even in our communities. Another thing that I'd like to highlight, even as I close, is the feedback mechanism. A lot of times we leave that behind. So the monitoring and the feedback mechanism when dealing, especially with communities or with the leaders that we have been talking about, it is important to get feedback. That feedback loop helps us to understand what progress are we making? How can we better adapt? How can we better improve or enhance this comprehensive sexuality education in a way that it speaks to the community's needs and is not just what we want to see or what we want to hear? So it's important to create an opportunity where feedback is received. That loop is very important for us. So even as we go into communities, as we try to get buy-in, as we try to engage the key stakeholders at the community level, let us create an opportunity for them to be able to at least provide a feedback for us. It would help us to assess how well, if we're reaching the goals that we've set out to reach or the objectives that we've set out to achieve, but it will also give us more insight into communities. I cannot overemphasize the importance of champions or role models who are very well knowledgeable, that we've taken the time to educate them about the benefits of CSE. They are very critical. And there are role models or champions amongst our parents. There are role models and champions amongst religious and traditional leaders. We need to find them. We need to educate them. And it's part of the peer-to-peer approach, because they also would do a great work in helping us get others to align with us on the benefits of CSE. And like I said, incremental approaches are very key. Start light, start with the less controversial issues, start with the less contentious issues. Then as we build the trust, we can now go into more controversial issues like sex or, relationships, which are things that a lot of times, leaders don't want to hear about. But it's also highlighting to many that there is also something known as age-appropriate comprehensive sexuality education. Because I think when we look at our cultures largely do not encourage discussions of sex, even within the home front. But we need to put at the forefront the fact that comprehensive sexuality education is also age appropriate. So there are different levels of information and education open to young people as they go through their formative years. Those are ways that we can, as a collective, work through advocacy to get communities and our leaders to get buy-in. And let's also encourage dialogue. I know a number of people have talked about this. I'm not going to flog that issue, but dialogue helps, in terms of mutual understanding, transparency. Something that I have seen work well for us as AHF is the parent-children or parents-ward or parent-young people dialogue. When we bring young people and their parents into the space, and sometimes even if they're in separate spaces, it allows for better understanding. It allows to build more trust, and it allows for us to make more advancements even as we continue on the work or the journey with comprehensive sexuality education. Thank you very much.
Thank you so much, Kemi, for your submission. I would like to now invite Maria. Please be mindful of time. We have less than 20 minutes. So the question is, what promising practices and lessons have been learned in implementation of CSE both in and out of school that are culturally sensitive and religiously sensitive, yet they are effective in driving issues of HIV and teenage pregnancies? Kindly share with us in strictly 3 minutes. You're welcome, Maria.
Thank you very much. A lot of what I said before also gets at the answer to that question. But one thing I really wanted to build on from what Kemi said is, nobody's born a parent. It doesn't come with a manual, and we're all trying to do our best for our children. And parents and religious leaders and traditional leaders need to be trained in how to discuss these issues in a balanced way, and so the very little data that we do have suggests that anytime parents have a basic conversation around condoms, where they're not seen as a negative thing, but to say that when you're responsible and in a stable relationship or whatever your values are as a family, from the parent to their own child, having that conversation before a young person has sex for the first time increases condom use 20-fold. Now, I don't know about you, but as a parent, I would like to believe that, I hope I have that conversation with my child that can, when they're ready, and that's a whole conversation, that the first time they have intercourse, they use a condom and they continue to correctly and consistently use condoms until they're ready to, have a child or whatever. And so, the empowering the partnerships and building the capacities of partners is critical, and engaging in real sensitive conversations around what are the good aspects of culture, why were these practices there to begin with, what purpose did they serve, do they still serve us now, are there any negative consequences, and not for the educators to project that, but to have the young people to consider that in the realities of their lives. The other kind of last point I wanted to make in my very little time is sexuality education creates the demand for services. So in all this conversation, or perhaps for a topic of a future webinar, once we've developed this demand for the services, we also have to work in partnership with the service side, the health facilities, the health providers, self-care mechanisms, so that they are also of good quality and that young people, their sexual and reproductive health outcomes are improved because they feel free to make those informed decisions and access services, and it's their right to do so. I have a lot more to say, but I know time is limited. But really, empowering parents and parent-child communication programs and working with religious and other community leaders like traditional leaders is critical to the success of CSE. And we can do it better, we can do it together, and we can really do that monitoring and evaluation like was suggested to really see the impact over time. Let me stop there. Thank you.
Okay, thank you so much, Maria, for your submission. I think I want to just thank all the panelists for responding to the two sets of questions, your insights, your recommendations and experience that you've shared really is very interesting. And one of the things that we mentioned at the beginning as part of our objectives is also learning. And most of the things that you have shared with us, we have learned, but most of the recommendations also forge part of the advocacy plan that we envisage to develop in continuing to advocate around full implementation of comprehensive sexuality education. Our next session at the moment supposed to be an open conversation to the listeners. And because of time, we are changing the approach a bit. Most of you have been able to raise questions and comments within the chat box, and I'm going to be very selective to allow us to work within the time. So I want this question to go to Reverend Godson. One of the questions that have been asked to you, directed to you, is that how do you, or how have you been able to teach CSE in the religious setting? Or okay, someone put it in church. How have you been able to teach CSE in church? That would go to Reverend Godson. The second question goes to Maria. They're asking about which kind of resources have you been using to train faith leaders and parents on comprehensive sexuality education? And the other question I think goes, or Kemi, you can react to it, like community leaders are facing challenges to spread CSE messages, and there is need for CSOs and NGOs to develop interventions that will attract people to listen to CSE. I know, Kemi, you have reiterated on that, but I think this provides you an opportunity to re-emphasize on the role of CSOs and NGOs, CBOs in designing sensitive messages, age appropriate on CSE. So you'll highlight, give more highlight on that. So you can come through Reverend Godson as I also identify the questions to Trevor. Just use between 1 and 2 minutes so that we are able to work within the program. Yes, Reverend Godson.
Thank you very much. I think for me, it was very easy because since 1989, I was involved in HIV activities. So HIV helped us in the church to break the silence and also to talk freely about sex contamination and mode of prevention of HIV. So today, doing the shift from HIV to talk about CSE, for us, it is easy because we can talk about sex freely today in the church, because in the past, we had the opportunity to talk to the church members through HIV sensitization. So this is one of the aspect. And the second aspect, we have the issue of sexuality and toxic masculinity. So through toxic masculinities related to gender-based violence, we also talk about CSE, so that the girls and the boys will have the same education, the same opportunities, and the same future. So through that, we can have so many activities around HIV, around the masculinities and femininities. That's what we are doing in the church today.
Okay, thank you so much, Reverend.
Yeah.
Yes, Maria, on the resources, please come.
Yes, thank you. So from the UNFPA side, and we also have other UN agencies that have materials as well. We have a number of facilitator manuals, for example. We have a general out-of-school sexuality education manual that's on our website. I can share links with the organizers. And then we have a specific parent-child communication manual called Let's Talk that has, exactly as Kemi mentioned, sessions first with, separate parents and young people, and then mixed sessions where these conversations take place. We have different resources for young people living with HIV, young people with disabilities, to ensure that the messages are really targeted and customized for their own needs. And we are building our resources around faith-based. Sorry, my light is going off. Okay. Faith-based organizations where we really want to look at scripture, and some of it is very sexuality positive, right? The body and what was created and its potential for pleasure under consensual conditions and things like that. There are scriptures around all of this. So yes, we have a number of resources. We have videos, lots of amaze.org/ZA is another video source. We can share those with the chat, and we'd love to be in touch and work with you and your organizations in doing this work together going forward. Thank you.
Sure. Thank you so much, Maria. So the aspect of dissemination of those resources, most importantly, interpreting them in the language that people understand. It's been very strongly emphasized on. Yes, Kemi, as you come through, there was also a question on how has AHF supported advocacy around comprehensive sexuality education. Yes.
Okay, thank you very much, Diana. So that question I'll tie to the first one on civil society and just speaking from my experience. So one thing is the need to build the capacity of civil society organizations, and that includes NGOs, local organizations such as your CBOs. We often forget them when we talk about conversations on CSE, but it starts with building the capacity of CSOs to understand what comprehensive sexuality education is, what are the benefits for young people, for our society, our communities, including public health, because it does have ripple effect. It does have compounding benefits on our overall public health. So capacity building is very key. Number two, Maria talked about partnerships, and that's true. I did mention collaborative approaches. So that's something as AHF we have done. Even this webinar is an example when we launched the Protect the Child campaign. So it's also targeted campaigns that speak to the issue of CSE, because it allows that opportunity to educate people on why CSE is beneficial, how it is beneficial. Also, peer-to-peer approaches, empowering peers to be able to reach out to their peers. We're seeing that work very strongly in some of our countries like Nigeria, being able to use peer-to-peer approach to educate about CSE and all the components of CSE. I like when Trevor talked about the fact that it's not just about sex, but it's a key part. But there's so many other areas when we talk about consent, when we talk about healthy relationships. There's so many other areas of CSE that CSOs have a role and responsibility to actually amplify in order to get more buy-in, get more acceptability, even in terms of implementation. Another thing that CSOs can do is also in the area, which is what we've done, like piloting CSE programs, piloting implementation, starting small, seeing the results, and being able to use that to demonstrate, being able to use that to support messaging, whether it's on social media. Today, we're in a digital age. We need to have more campaigns and awareness driven by evidence, driven by data, driven by what we are seeing on the ground, so that way, when we engage people as civil society, we do not just come from a place of emotions, but we're coming from a place of knowledge. And there are many studies to show, there are many tools, frameworks that allows us to be able to deliver CSE. And we're still learning even as we go along. So I would like to stop here and maybe just emphasize on monitoring and evaluation, because that's also something that as civil society, it can help us in our advocacy work. People, when we're talking to parents, when we're talking to the traditional leader, when we're talking to religious leaders, is being armed with evidence that can show them that CSE does work. For those of us, especially AHF, who is in the HIV field, we've seen to a great extent how CSE is helping can we be able to amplify more of that? And that's what we're doing, the focus on teenage pregnancies, HIV and STI reduction, delaying of sexual debut, which is often a concern for most parents, that young people become promiscuous because of CSE, but then that's not the situation. So those are ways that civil society can help to continue to amplify the work that we do around CSE. Thank you.
Thank you so much, Kemi, for your submission. And Trevor, please, in 1 minute, a question to you. How have you been able to holistically include all young people in the conversations of comprehensive sexuality education, including those who are in and out of school and those on the streets? How have you been able to involve them in this conversation? Please use 1 minute or two.
Thank you. We are also, as young people, we are also very deliberate to ensure that while we are speaking about other stakeholders to involve us, we are also conscious about ensuring that we involve ourselves. So, fortunate to be a youth programmer, I have taken the opportunity to ensure that the young people are often involved in the planning of these campaigns. And I want to appreciate that we have had structures like parliaments. Last year, we had a high-level parliament, mock parliament, where we had different levels of stakeholders, from the high level, like the members of parliament, the youth-led bodies, even a religious leader, I remember, parents being a part of the conversation and ensuring that the young people, the conversation was emanating from the young people to the stakeholders. So we want to ensure that the young people are the ones holding the stakeholders accountable, because CSE is for our benefit largely because we are the youth. So when CSE is achieved, or when we have this in place, then the young people are going to be more empowered, well informed, and more understanding. So we have engaged young people. We also just recently had another engagement during the Youth Day celebrations that went so well. But the main point is having the conversation emanating from the young people and them informing policymakers on what they want to be done. So we will continue relentless in this advocacy to ensure that CSE is achieved and we have this enrolled in the different school settings. Thank you.
Sure. Thank you so much, Trevor. And to all our panelists, please give a hand of applause using your emoji to our great speakers. They've shared insights and highlights, sharing experiences and lessons learned on implementation of comprehensive sexuality education, reflecting on the roles of faith leaders and parents in accelerating full implementation as a prevention tool to address HIV and the rising cases of teenage pregnancies. I would like to help us summarize and bring together this whole conversation, just giving insights of what speakers have mentioned about. Then we go into the closure of this webinar. I would like to remind us from the data that has been shared that prevention targets for HIV are still very low, and this is reflected with the high numbers of new infections among young people, especially the adolescent girls. And so globally or worldwide, everyone is coming together to forge solutions and approaches on how to reduce the HIV infections and issues around teenage pregnancies among young people. And one of the approaches is full implementation of comprehensive sexuality education, reflecting on the roles of different stakeholders, including the faith and faith leaders and the parents. So coming in from our speakers, there are a number of issues that have been reiterated. Reverend Godson highlighted a number of issues. To mention is that we need to do more to create more awareness, passing on the right information in a language that they understand about comprehensive sexuality education. We need to strengthen partnerships. Let us not fear them. We need to trust them. Can we take this conversation before even we get into development of these frameworks, guidelines? Can we sit on the same table as we start processes of even thinking to development and involve them from the first stages, initial stages of developing even the materials? So they are calling out for us to involve them in all aspects of implementation, including involving the parents. We went to materials development. Can we develop them in a language that they understand as faith leaders? And then he also mentioned of integrating CSE in in the training curriculum in the theology school, so that it is whoever is assigning for the theology classes and all that, they are able to have this integrated right away from the training and not waiting for them to come out. It is kind of hard. Then Kemi mentioned about breaking down the messages to the language still that they understand. She spoke about different entry points, that we not just need to go and ambush faith leaders to speak to what we want. We need to help them understand, break down the messages. Can we embrace different strategies like integrating them into menstrual hygiene conversations and programs? Can we equip religious leaders with this information? Can we communicate the benefits of comprehensive sexuality education? Because they need to understand why we are doing it. And one of the things that we have just done is sharing with this data and information. How do we break down this data and link it to the understanding of faith leaders? Because everyone here would be able to understand the data. What about those other faith leaders who are there? Are they be able to interpret this data? So can we interpret the messages, the research, everything that we are doing around comprehensive sexuality education in a language that religious leaders understand? In regards to issues around young people, Trevor was very clear that we still have misconception around sexuality education and sex. So in our communication materials and information, let us be clear in the talk shows that we hold, in the materials that we develop, conversations platforms that like these ones, let us be able to define and differentiate to allow people appreciate and understand. And this will help in us winning them on our side. Age appropriate information, this should be emphasized so that we are also able to have our parents, our religious leaders trust in us as we move this journey of implementation of the sexuality education. Where Trevor spoke to open dialogue, one of the things that has worked on his end of engaging with young people and other forms of stakeholders, including faith leaders, having open conversations has been able to help faith leaders appreciate their role in advancing the conversations around comprehensive sexuality education. Maria spoke to having parents as key partners in implementation of comprehensive sexuality education. And as we talk about parents, it is important that we define other partners, including faith leaders, in this whole agenda of sexuality education as a tool, as a preventative tool. Then I recall so well mentioning that parents are primary educators of sexuality education. So Maria spoke to different materials that we have. Not all institutions or organizations have access to these materials. So if it is UNFPA with those materials, how are you working with different governments and stakeholders to make sure that we have materials and information that is going to be used by all stakeholders in advancing this agenda? So we all are different levels of understanding, and so let us try to disseminate this information at different levels in a language that everyone understands. Then the other aspect was implementation modalities should also be defined very well. It is not a one size fit all. So as we do implementation of comprehensive sexuality education, let us know the types of different groups that we are engaging so that implementation becomes very easier. So it means that as we get into another session or conversation or meetings outside this webinar, is for us to agree on the implementation modalities of the comprehensive sexuality education. Then I think in the second round of questions, it was just highlighting additional issues. Reverend Godson still emphasized on the issue of addressing issues of toxic masculinity, and then also emphasize the issue and opportunities for us to partner with them. He has actually assured us that faith and cultural institutions are open to having this dialogue and partnering with different stakeholders in advancing this agenda. We are so glad that even in your interfaith conversations that you spoke about that you held last year, you had CSE as an agenda. So we encourage that in the conversations that you're having within your faith space, you also invite speakers from such groups, UNFPA, AHF, to be part of the conversation, to continue, educating and creating awareness, but also learning how to engage, faith leaders and being part of those conversations. So Kemi, thank you so much for emphasizing the need that to build capacities of CSOs. We need to be on the same page. We could be having different information about comprehensive sexuality education. So can we have materials that we speak to that communicate the same message, communicating the benefits, and then different concepts about comprehensive sexuality comprehensive sexuality education. You also importantly spoke to monitoring. So we do a lot as different stakeholders, let it be government partners, but I think the aspect of monitoring progress on how far we have done is very important, because even as we speak right now, having Reverend Gideon and all players on the call means that we have moved thus far in pushing and bringing stakeholders board in implementation of sexuality education. So thank you so much, everyone. We take note of everything. A report will be shared to all people who have participated in this discussion. And at this point in time, I want to invite Rahma, being one of the young people moderators, to give her parting shots, but also invite Dr. Penny to close for us this webinar. You're welcome, Rahma.
Thank you very much, Diana. Today's webinar has been very fruitful and rich in terms of the knowledge and insight that we get from different people who are actually engaged with us. And I would like to acknowledge your participation with us today. Thank you very much, everyone. From my side, I would like to say that in terms of comprehensive sexuality education, we know that like we've been facing a lot of challenges, and we've been hearing also from different panelists their suggestions in terms of going a little bit slowly in terms of implementation and stuff. But I would like to acknowledge the effort of other networks as well from different communities, because we know like they are also like they've been doing a lot of incredible jobs in terms of comprehensive sexuality education. But now the question is like, when are we ready to start implementing the comprehensive sexuality education fully 100%? To ensure that we secure the lives of young people in the sub-Saharan African countries. But I also like to highlight one of the key aspects that was highlighted by our faith leader, where he said it's also very important to promote the positive lifestyles and behavior of young people. And I think I agree with him, because I think this is also one of the key elements that will also inject more effort to be able to implement more realistic interventions in terms of comprehensive sexuality education, because this we can use this as a point to influence and inform different mechanisms for people to be able to accept our agenda. Yeah, the other thing, support will also require support from different stakeholders. Thank you very much for you to engage with us today. This is also one of the response on how we can actually reach further. But I also like to acknowledge some of the important elements in terms of the quality and standard of comprehensive sexuality education implementation. We know like we still have some initiatives underground, but who is actually in charge of making sure that we have like met standards to make sure that we reach out to those indicators? So I think this is also directed to our key stakeholders, including UNFPA and others, how they can actually use their efforts and resources to make sure that we are also covering up to this. And the other aspect in terms of resources that we are using. So yeah, that's all for my side. And thank you very much, everyone, for your participation.
Sure. Thank you so much, Rahma. So I would like to invite Kemi on behalf of Dr. Penny to close for us this webinar. You're welcome, Kemi.
Thank you very much, Diana. And on behalf of our Africa Bureau Chief, Dr. Penina Yutung, for the AIDS Healthcare Foundation, I think we've had very rich discussions and insights that have come from both the opening remark to the presentation around the updated HIV, the new HIV report, and also the speakers. And one thing is clear, we've come a long way. If we can have Reverend Godson on the panel with us, with his positioning, even with as a vice chair of the Africa region, the vice president of African Council of Church Leaders, it shows that we can make more progress. So the charge that I have here is a lot has come from our conversation today, and we need to keep the momentum going. We need to take this conversation out of Zoom into our communities. It is to go back and look at the curriculum that we have. It is to go back and look at the frameworks, the policies. Where are the gaps? Where are the gaps that we need to fill? So much has come about the strategic ways that we can reach religious leaders. And I think that's very instructive for us, especially those of us who are implementing CSE in our different capacities. The same for parents and young people. Can we go back and look at the materials we have? Can we go back and look at the messages, the studies, what we have? Is it speaking to the need as it continues to evolve? There is no gainsaying that CSE does have immense benefits. It helps promote gender equality. It helps young people, keep them safe from GBV, from HIV, from teenage pregnancies. And we know that our continent today, as Africa, is bedeviled by a lot of these issues. And we want to see these numbers go down. We want to see an improved and enhanced report on the overall health and well-being of our young people. So the onus is on all of us as stakeholders, because all of us in this place are critical stakeholders at different levels, to go back into our communities, go back into our spheres of influence, and try to ensure that, you know, that CSE is meeting the needs of the communities, that young people's voices and insights and ideas are part of what is communicated and shaping our CSE response, that we also go back and make sure that communities have ownership of CSE responses. And it starts by involving them from the very beginning, with our parents as primary leaders, even with teachers, you know, teaching them and equipping them, building their capacity to be able to deliver CSE in a way that is culturally sensitive, adaptive to the context, but also not compromising the quality and the core principles that it stands for. So I want to thank you on behalf of all the partners today, and that is the Education Plus, which is a joint initiative of the United Nations, the African Reach, and AIDS Healthcare Foundation. It's been our pleasure. Thank you to the moderators for such an excellent job, as well as all the panelists and all of you, more than 200 of you who have showed up today for this conversation. We hope that you've taken something out of this and go back into your communities for us to continue to drive the change. The work is not done, but at least what we have seen shows us that so much is still possible as we continue to fight against new HIV infections, ensure people stay in care, and continue to use advocacy to drive meaningful change across the board, with policymakers, government, and across the board. Thank you all very, very much. And have a good evening, good day, wherever you are. Thank you, Diana.
Thank you so much, Kemi, and thank you to everyone. Thank you to our panelists, and have a good afternoon, good morning, and good evening.